Hi everyone, my name is Tanya Thadikaran and I'm really excited about today's episode. My guest is Dr. Ranjith Ramasamy, a consultant urologist at Jumeirah American Clinic in Dubai and someone who's considered one of the leading voices globally in male fertility and reproductive health. Before moving to Dubai, he spent several years in Miami as the director of reproductive urology at the University of Miami, where he became known not just for his clinical work, but also for some incredibly important research in this field. He's published over 500 scientific papers on everything from sperm counts and testosterone to infertility and men's sexual health. His work has been recognized with the Gold Cystoscope Award from the American Urological Association, which is one of the highest honors given to a young urologist. But what I really like is that he's not just all about the science. He's able to talk about these topics in a way that makes them very easy to understand. And he's helping bring a lot of awareness to subjects that are often ignored or not spoken about openly. He's here today with us to help us understand what's really going on when it comes to male fertility, why sperm counts are dropping, what affects sexual health, and what men can actually do about it. I truly hope you enjoy the show. Welcome, Dr. Ranjit, to the podcast, and I'm really looking forward to this. So, Doctor, what exactly is sperm quality and sperm quantity, and why is it important?
Sure. So, anytime a male fertility potential is being evaluated by a doctor or a man wants to get a sperm analysis, there are three important numbers in the sperm analysis report that we should look at. Number one is something called sperm number or sperm concentration. And the normal number, according to the WHO guidelines, is 16 million per cc. So for every cc of ejaculate, 16 million number needs to be there. So that's what's determined to be normal. And so this is just purely a number of sperm that is important. There are two parameters, something called motility and morphology. Motility means the percentage of sperm that are moving. Out of 100 sperm, 42 sperm should be moving. So 42% of them should be motile, and that's been determined as a sperm quality metric. And the other quality metric is something called sperm morphology, or the shape of the sperm. And 4% of them have to look normal like a sperm. So anytime you're looking at a sperm analysis report, you're looking for both sperm number and sperm quality. And with sperm number, you're looking at concentration. And with sperm quality, you're looking at both motility as well as morphology.
Doctor, why do you feel that sperm count is declining over the past few decades?
So between 1960, when we started originally doing sperm analyses, and the year 2000, we actually did not notice much of a decline or a change in sperm number. But over the last 25 years, with the records that we have, maybe we're just looking at these numbers closely now, but we've noticed a steady decline in the numbers of sperm. And this doesn't mean alarming. This is not meaning that the evolution is going to end and the sperm counts are going to completely disappear. But even within the normal range, we see the numbers keep going down. Okay. And I think a large part of it is because of changes in lifestyle that we've done to ourselves as a society. Our sedentary lifestyle has probably contributed most to this. I think in our previous generation, and our parents and grandparents were far more active than we are now. They were biking more, cycling more, walking more, physically way more active than any of us in this current generation. And I think exposures such as fast food and processed food, ultra-processed food, chemicals, toxins that we are exposed to because of modern industrial revolution, all of these things that have happened to advanced technology, I think has also set us back in terms of both sperm counts and sperm quality. So I think all of these things are contributing factors to why we potentially think that sperm count is declining as a population as a whole. And I think we're also beginning to realize that as couples grow older and wait longer to start their families, we are realizing that the sperm counts and the egg counts and the quality are probably not as good as when they had started planning for their families earlier.
Absolutely. And family planning has been pushed in the last few decades.
Absolutely.
So
Absolutely. I think there are lots of examples in Hollywood with, Robert De Niro, Al Pacino having kids at 80 years old. Those are extreme examples. But unfortunately, we as a society think, if they can father children at 80 years old, why do I need to have kids at 30? And so they push, parenthood. They want to establish their careers. Women want to establish their careers before they start planning families. All right things. But I think we should realize that it just becomes tougher as the population gets older, and we try to have kids at a much later age.
Yeah. And I think the notion is that for women, there is the biological cycle and a certain age that you have to, have children in. But I think for men, generally, the notion is you can push it beyond, even into your 40s. I mean, what's your opinion about that? Do you think there is a difference between having between the male fertility in their 30s versus 40s? How does age play a factor?
Advanced paternal age is a concept that is not talked about much. Yeah. Everybody knows advanced maternal age. Yeah. After the age of 35, 37, 39, I think we do know that both the egg numbers and the egg quality declines pretty rapidly. But in men, the drop-off is not so sudden. I think men continue to make sperm their whole lives, but we don't know much about male reproductive aging. As men get older, I think the sperm number may not decline, but I'm fairly certain sperm quality will decline. Okay. And so when you use poor sperm quality to go on to make children and babies, two things can happen. One, it'll be more difficult to conceive naturally. Or when they do conceive, I'm fairly certain risk of miscarriages, pregnancy losses, birth defects that happen in children will all definitely be higher. So I think, yes, men can make sperm their whole lives, but I think we need to realize that the sperm quality will decline in men as they get older. And couples that are planning to have kids much later in their lives with an older male partner just need to realize that some of these risks may happen.
Absolutely. That's very insightful. Usually the focus is mostly on women's fertility and age, but I think it's very nice that you've opened our eyes to the other side of it as well. Connecting to you speaking about obesity and exercise and how that could affect, how do you think obesity actually affects sperm count and quality?
Sure. So obesity can affect both sperm production and testosterone production. Two ways. One, I think when men are obese, the temperature around the testis will actually go up. Testis is cooler. It's outside the body. It was placed outside the body evolutionarily to be around 34 degrees centigrade. Body temperature is 37 degrees centigrade. So when you have obese thighs around the testis, they locally increase the heat around the testis, and this will affect both sperm production and testosterone production inside the testes. And number two, men who are obese have underlying chronic inflammation. Inflammation basically leads to increased reactive oxygen species. These are metabolites that can potentially affect both sperm quality as well as testosterone production. So I think in men who have obesity, who have an elevated BMI, I think both local production of sperm and testosterone from the testes can be affected because of the heat, and systemic production because of the chronic inflammation can also be affected.
So we spoke about obesity. Now, coming to food, what role does diet exactly play, especially processed and fast food like McDonald's? I mean, the culture has become so much that I think the younger generation, I don't think we overthink having fast food, and there's so many options out there. How do you does that affect sperm quality and quantity, and is that something that we need to look out for, be mindful about?
So the most common cause for why sperm counts are low in men is actually unknown. We don't know. We are unable to identify in most men who come to my clinic and say, "Doc, my sperm count is low. Why is it low?" We actually cannot find a cause, most of them. And sometimes we can find a cause, we can fix it, and we pat ourselves on the back and say, "Wow, great job. We're able to fix your sperm count. We can improve it." But majority of them, we just put them into this bucket called, "We don't know why your sperm count is low." And in modern society these days, which has changed in so much ways, I don't want to say advanced, but really changed in so many ways compared to 20 years ago, where fast food was not that prevalent. Ultra processed food was not that prevalent. Additives, supplements that get added into these foods were not that prevalent. The way meat was grown, meat is raised, chickens are raised with hormones, antibiotics are not that, are very different these days compared to 10, 20 years ago. And so I think what do all these how do all these factors affect sperm counts and sperm quality? We actually don't know. And I think honestly, if we think about how it affects overall metabolic health, overall cardiometabolic health, it does affect it. We do know fast foods and ultra processed foods are not good for the overall health because it increases chronic inflammation. If it affects the whole body, it has to affect both sperm production and testosterone production. And so I think we may not have enough research because I don't think we're going to have fast food companies funding research to see how it affects the body in a negative manner. But I think we as a society just need to realize that if men and women, for that matter, who are attempting conception, are consuming a lot of fast foods, are consuming a lot of ultra-processed foods, are consuming a lot of frozen foods, are always eating takeout food, I think, and their sperm counts are low, and there are no other factors for why they can explain why the egg quality is poor or the sperm quality is poor. I think we should limit it. We should try and see if we can try and cook more, buy more fresh vegetables and fruits, and try and consume that to try to see if it makes a difference in their sperm counts and in their egg quality.
Okay. So overall, a healthy lifestyle when it comes to diet, exercise.
I think so. I think it's very underrated these days. People often think that they can, just stay on their devices and get away with not exercising, not dieting, not eating well, not, and somehow say, my friends are able to have kids. They lead a lifestyle like me. Why do I need to follow that? It's not the same. I mean, you can always say, my friends are smoking, he didn't get cancer, why am I getting cancer, right? We still don't know the answer to that question. Yeah. I think in general, I think if we are able to lead an overall healthy lifestyle, that's the best thing you can do for your sperm counts and egg quality on the female side as well.
Absolutely. What about other factors such as stress, poor sleep, a sedentary lifestyle, which most of us have? Mm-hmm. I work in the IT industry, and I know I'm sitting at my desk for like 9 hours a day, and I'm sure that's got to affect most of us these days. So, I mean, what about these other factors? Do you think it all adds to it, or?
Absolutely. I don't think there is one couple who has come to my office and I say, are you stressed? I don't think there's one person that says no. They all say yes. No matter what job it is. I mean, if an air traffic controller comes to my office and says, Doc, I'm stressed, I'm like, yes, I can understand. Yes, that is a very stressful job. But someone who works in consulting also tells me that they are stressed. Someone who works in management and finance tells me that they are stressed. Someone who works in advertising tells me they are stressed. So no matter what occupation we choose, we have somehow taken it upon ourselves to be stressed. Low levels of stress, I think, is very good for the body. Okay. We do need the amount of adrenaline, amount of cortisol for metabolism to function well. But high levels of chronic stress with almost no breaks, no vacations, and you take your work home where you're constantly thinking about work at home, I think all of these will have to affect it. Because if we just compare ourselves to the generation before us, they were not doing that. We did not. Yes. Our parents and grandparents led very different lifestyles. And I think if we were able to populate ourselves to 1.7 billion in India and 5 billion overall, I think we have to answer ourselves the question, what have we changed? Why is infertility such a big problem? Why are 1 in 6 couples struggling to have a child? And I think all of these have to be answers in that equation.
Is there anything like too much exercise? I mean, I know regular exercise and generally being active is important when it comes to sperm fertility, but are there any side effects to too much of exercise?
So as long as the exercise duration is in bursts during the day, I think it's totally reasonable. Okay. You cannot overwork your body for an hour or two, but if you're running marathons 2 or 3 times a week, I think that's not right, because there's something called hypothalamic crisis that can happen where basically your brain shuts down because your body is exercising too much. Very common in runners, especially in females, where they run for a very long time. For frequently, they can get something called hypothalamic amenorrhea, where they will no longer have menses at all because they are, exercising too long. So I think yes, there is something called too much exercise, but I'm fairly certain we will not reach that.
What, in your opinion, just curious, is the ideal amount of exercise?
So I think many studies have shown that about 30 minutes to 1 hour, 3 times a week, I think seems to be the ideal level of exercise, both to increase lifespan, increase cardiac lifespan, improve metabolic health, is plenty. We don't have studies in sperm and egg quality to say that, but I think if it improves the heart and longevity, it'll probably improve the sperm as well.
And that's a very reasonable, I think,
Correct.
number of hardly a couple of hours in a week.
Yes.
So, yeah.
We think about it. I mean, we spend about 10 hours on social media on
Yeah,
average.
absolutely.
And if we want to allocate 2 hours to, exercising and lifestyle, somehow that seems a lot.
A lot. Most of us don't do it. Yeah.
Correct.
I understand all these reasons and factors that could help increase sperm count and quality, but have you actually seen this live? Have you seen patients or men actually improve their sperm quantity and quality by making all these meaningful changes, exercise, diet, reducing smoking, stress, improving their sleep? Have you seen any sort of
Yeah, so one of the most remarkable things that have happened in the last, I may say, 3 years is the introduction of the drug called GLP-1 agonists with Ozempic, Mounjaro, and they certainly do cause weight loss. So we actually have level 1 evidence and level randomized control trials to basically say that the sperm counts will double in men who have lost 50% or 25% of their weight over a period of 6 months. So you lose. So if you're 125 kilos and now you've gone down to 100 kilos using Mounjaro or Ozempic over a period of 6 months, your sperm counts will actually double. So we do have evidence now. Finally, before we were just saying weight loss will improve, physical activity will improve, but now we have solid evidence saying that if you do lose 25% of your body weight, your sperm counts can double. And I think that is probably the best evidence we have that if you can lose weight, either with the help of medications or by yourself, that your sperm counts can improve. The other level 1 evidence that we have is with smoking cessation. Very nice studies to basically say that you actually stop smoking, not decreasing smoking, stopping smoking. And in 6 months, your sperm motility will also double. And I think that also is very good evidence to show that your sperm quality can improve if you actually stop smoking. I think we should talk about a lot of misconceptions around smoking. People often think smoking means cigarettes. But especially with the generation these days, it's the nicotine in the smoke that causes impacts on sperm quality. And so things like vaping, shisha, very common here in the UAE called midwa, and cigarettes are all contain IQOS, all contain either the same amounts of nicotine or actually much higher levels of nicotine that can affect sperm quality. So just men and couples just need to remember that just because they moved away from cigarettes and have now moved to more modern ways of consuming nicotine like vaping and IQOS, their impacts on sperm quality are still bad, probably worse compared to cigarette smoking itself.
But I mean, it's more of a lifestyle. I think most people try to avoid cigarette smoking these days, and I think they're moving towards smoking of marijuana and weed, and I think that's become more of a lifestyle now. I mean, how would you compare both? I think it's become very recreational, and most people think it's okay. Do you think that can also affect? I mean, it's not exactly nicotine, but then what are the side effects, and how could it affect sperm health?
So unlike nicotine, marijuana smoking actually has not shown too many negative impacts on both sperm and testosterone. In fact, there was one study that came out of Boston that basically said smoking marijuana, actually consuming marijuana edibles, seems to either not affect sperm quality, sometimes even improve the sperm motility. Nobody knows the underlying mechanism. There are cannabinoid receptors on the sperm that potentially can, affect how cannabis affects sperm quality. But for now, I think if you're trying to have a kid, the general advice that we should give all patients and couples is to try to stop smoking, stop marijuana consumption, and do it later after you've completed your family. But I think the impact of marijuana seems to be a lot less than nicotine and smoking cigarettes and vape.
Okay, so doctor, let's talk about supplements now. How do supplements like I've heard zinc, CoQ10, vitamin E, L-carnitine, how do they actually affect sperm health?
Sure. So these supplements work in a way to basically decrease the oxidative stress. Okay. So they're called antioxidants, and they're in the seminal plasma. There's something called reactive oxygen species. You need to have a little bit of oxidative stress for the sperm to function well. But if you have too much oxidative stress, then the sperm quality can be affected. Okay. Either the motility will be affected, or the chance of that sperm to fertilize that egg can also become lower. And so it can potentially be affected if the levels are too high. So some of these supplements that you mentioned, like vitamin C, vitamin E, zinc, CoQ10, selenium, have all been shown to actually decrease oxidative stress and can improve sperm motility. Most patients think that the sperm counts will improve by taking supplements. I think that's a misconception. Many studies have shown that supplements will not actually affect sperm number, okay, but if your sperm quality can be improved. So anytime a man and a couple is trying to improve their sperm quality, I think taking supplements for about 3 to 6 months while leading healthy lifestyles. I think I always have to preface that with that. If you're smoking 1 pack a day, trying to take 10 supplements a day, I think the smoking will always win. If you're very obese and you want to eat fast food all the time and you want to lead a sedentary lifestyle, taking 10 supplements a day, I don't think is going to improve sperm quality. I think taking antioxidants along with making lifestyle changes, smoking cessation, weight loss, improving physical activity, exercise, I think all of that will make an improvement in sperm quality, not quantity.
So the lifestyle changes improves your sperm count, and supplements like these improve your sperm quality. Is
That's
that
correct.
how it goes?
Yeah, that's
and
exactly
both
right.
have to be in a balance.
That's correct.
What about probiotics? I've heard that they're becoming part of fertility treatments now. What's the important role that they play?
So there is something called a gut testis axis. People often have ignored the intestine. They've always been thought as an organ where the food gets digested and gets excreted. And that's all they thought the intestines played a role. But over the last few years, there is a lot of interest in microbiome. So what is a microbiome? So basically, inside the intestine, there are good bacteria and bad bacteria. If you have a lot of bad bacteria, you have infections like gastroenteritis, diarrhea, vomiting, and so on. But good bacteria is needed for the food to basically digest properly. And that's all we thought that this bacteria does. But now we do know there's a lot of substances that these bacteria release that act on basically all parts of the body, all the way to the brain, all the way down to the testis. And so probiotics are basically medications that can improve the number of good bacteria. So if you don't have as much good bacteria, then these probiotics will actually supplement it and try and improve it. So who needs probiotics? So people who don't eat healthy foods, people who are obese, people who eat a lot of ultra-processed foods, people who eat a lot of fast food, don't have enough good bacteria in their intestines to actually support immune health or their gut health. Right. This affects pretty much all of the body, both the brain, and in our case, the conversation we're having today is about sperm counts and sperm motility and so on. And I think if you have enough of these good bacteria, enough numbers, and the correct type of good bacteria, I think it'll definitely improve the sperm health and metabolic health.
Okay, so that's the connection between gut health and sperm health.
That's correct.
And the same, is it like an axis? I mean, is it the brain also?
Absolutely. There have been many studies now that actually show that probiotics and microbiome actually will improve cognitive function in Alzheimer's disease. I mean, if it can improve brain health, it can certainly improve testicular health.
So, can you explain to us about seminal microbiome and how it affects sperm motility?
So, just like how the gut and the intestine have bacteria that are good and bad, the seminal plasma also has good and bad bacteria. There are white blood cells inside the semen that are responsible for proper sperm motility. If you have too many white blood cells or too many bacteria that are not good in the semen, it can affect the sperm quality. It can either affect the sperm motility or the sperm morphology, or as you mentioned, sperm DNA fragmentation, where it can break the sperm DNA. Sperm cannot fix its own DNA. It is a terminally differentiated cell. Only when it reaches the egg and fertilizes with the egg can its DNA get repaired. So by itself, if there are bad bacteria, if the seminal microbiome is not good, or it releases toxins that affect the sperm DNA and cause sperm DNA fragmentation, you cannot fix it. And so that's why it becomes very important for us to think about seminal microbiome, to have the correct amount of bacteria in the seminal plasma, to have the correct amount of inflammation in the seminal plasma for the sperm to function optimally. I think is just so important.
And how is that done? How do you achieve that? How do you keep it healthy and achieve that balance?
So if you are eating healthy and if you're exercising and if you're not smoking, I think you have an appropriate level of inflammation within the seminal plasma. I think thinking about using probiotics, thinking about probiotics that are targeted specifically for the sperm, I think is very important. Lots of research have gone into what bacteria, what types of bacteria are important for sperm health. Just similar to ovarian health and egg health, I think we just need to be cognizant that this is a new and an upcoming area of research. We don't know much about it, but we should certainly be thinking about factors that can affect sperm quality, especially in the men that we throw into this unknown bucket, where we don't know why your sperm count is low, we don't know why your sperm quality is poor. I think in those patients, we should be thinking about seminal microbiome and trying to see what we can do to optimize the microbiome in the seminal plasma.
Okay, this is also interesting. There's also been a lot of talk about microplastics and chemicals that disrupt hormones. What's your opinion on that?
Sure. So microplastics are basically very small plastics. So anything less than 50 microns or 50 micrometers that can be visualized only with a very high power microscope are microplastics. Plastics have come into our everyday life. Your water bottle is plastic. The cup over there is plastic. The food that we buy from restaurants is comes in plastic.
We don't even notice it anymore.
Yes, it's and if we think about 20, 25 years ago, we didn't have as much plastic around as we did. Plastics have now been identified in pretty much every ocean floor that researchers have done explorations on. Most seafood, fish, shrimp, have some level of plastics inside them. Most alarming research that has happened in the last couple of years, I should say, is that almost every organ inside the body has some level of plastics. These plastics are staying in there long after people have consumed from them, and they have no way to leave the human body. They just stay there. There's no way for us to excrete it out. They've discovered it in the heart, discovered it in the brain, discovered it in the liver, and important for our conversation today, discovered it in the testis. You would think that testis is a very protected organ. It has a very fancy blood-testis barrier, but researchers from the United States have actually discovered plastics to be present inside both the seminal plasma as well as within the testis. So how these plastics affect sperm count, sperm quality, how they affect cardiac health, brain health, I think we don't know. But I think a lot more research needs to get done to identify not whether plastics are present or not, but to see what types of plastics and what levels of plastics will affect pathology and cause disease.
And I'm sure it affects our organs in some way, though we don't know to what level.
Correct.
It's not good for us. But what can be done about it?
So I think we should be cognizant about what we consume from plastics. We should not be warming food from plastic containers and microwave ovens. We should not be putting hot food from the stove directly into the plastics. And we should try to limit, our water, milk consumption from plastic bottles on a regular basis. Try to avoid, carry our own water bottle when we leave our houses, because we're going to get plastic water bottles when we leave, because we just don't have access to non-plastic water bottles anymore. So I think we should just think about what our parents did in the past, and how plastic water bottles did not exist. It was a luxury back then, and how now that's the only option that we have, and be cognizant of what we consume from plastics.
Absolutely. There are too many choices out there today.
Yes.
So it's a boon and a bane,
Yes.
I think.
Yeah, and the concept of trying to make our lives easier, and trying to think that we are technologically so much more advanced, I think we as a human race have figured out a way to harm ourselves. I always tell patients and friends and colleagues, we don't need an asteroid to kill the human race. We don't need dinosaurs to come back and kill the human race. I think we have figured out our own recipe to, ending the human race.
Is there something men should be genuinely worried about when it comes to their own fertility?
So I think anytime men are thinking about fertility, they are concerned about future fertility. I think getting a sperm analysis is a very simple test. Unlike females, where evaluating fertility in a woman is a far more complex process than in men, I think getting a sperm analysis is very straightforward and simple, especially now with global declines in sperm counts, especially with male reproductive aging. As men get older, we think their own sperm counts could decline with age. I think when men turn 18 to 20, as part of just regular routine screening, if they are planning to get married anytime in the future, if they are planning to start a family anytime in the future, I think getting a sperm analysis, if everything is normal, then I think it's fantastic. If it is low, to try and see what they can do to try and improve their sperm counts, regardless of when they're going to get married, when they're going to start a family, I think is a very good idea.
But I think the unfortunate fact is that until we reach that stage, most people don't even do these regular tests.
Correct.
So the awareness is lacking until it's probably a little too late.
Correct.
And the need is there.
Yes, I think so. But I think COVID has somehow shifted the mentality a little bit.
Yes.
I've seen a lot of young single men now coming to clinic, just wanting to get their fertility checked.
Oh, very nice.
Women have increased awareness now. They get married, they ask their partners to go get checked, even if they're not. They're like, Doc, we're going to have our kids in the next year or two, but we just want to make sure that everything is okay, is a common conversation now. Before COVID, that almost never happened.
Absolutely.
You never saw a man come into clinic saying, I want to get my fertility checked. It was always the female partner dragging the guy into the office saying, please do this test for him because I have spent X amount of money and gone through X number of tests already, and he hasn't done anything for this equation.
It was almost taboo, I think,
Correct.
and considered not required.
Correct, because most men think that they're okay.
They're okay.
They've grown up well, their puberty was well, their hormones were well, they're performing well. They think the sperm counts will also be okay, but that's not necessarily true. These two they can be connected, but just because you have everything else okay doesn't mean your sperm counts are going to be okay. I think it's very important to get it checked, and if it is low, to think about trying to see what you can do to improve it. I think is very important.
Correct. And the earlier, the better, I think,
That's
in
correct.
terms of treatment and
Absolutely.
everything. What are some of the practical things that men can do to reduce their exposure to toxins and just the lifestyle factors that don't contribute to good sperm fertility?
Got it.
What do you think?
So I think if you're smoking, stop smoking. I think that's the easiest thing you can do. If you are overweight, try and lose the weight. Doc, how should we lose the weight? However you can lose the weight. Intermittent fasting, keto diet, Mounjaro, Ozempic, whatever you need to do, just lose the weight. Come back to the normal weight and you're good. So I don't really advise on specific strategies to lose the weight because different things work for different people. And whatever works for you, please do that to try and lose the weight. Move away from the sedentary lifestyle. We talked about 30 minutes for 3 times a week physical activity. anything, cardio, exercise, walking, running, anything. Because not everybody has access to a fancy gym. Not everybody has access to a walking path. Whatever you have access to, try and do that so you can get some physical activity in. And I think simple things like not having the laptop on your thighs all day because it produces both heat and electromagnetic radiation. Both we know can affect sperm counts. Try not to do that. Saunas, hot baths and steams have become a very common part of human life now. And I think if you are doing that, try and see if you can avoid it.
Does it really affect sperm?
I think I always tell patients everything in moderation is okay. If you're doing saunas for about 15, 20 minutes once a week, I think that's totally fine. But you see some people do it for 30 minutes every time they come back from work or every day they come back from work. I think that's excessive. Some people have saunas inbuilt in their house, and that's not right. And so I think anything in moderation is totally okay. Anytime it becomes excessive, I think that's when it starts causing pathology.
Yeah, and I think that goes for most things in life, right?
That's
like
true.
we have
Yes.
to live in balance and
Yes.
moderation.
Yes.
At what stage should a man with low sperm count consider getting treatment? Most of I think the factors or the options that you spoke about are preventive and how we can change our lifestyle and maybe maintain a good sperm count. But suppose someone comes to you with an already very low sperm count, what are the possible treatment options? What's your first, second, third course of treatment for them?
Absolutely. We see a lot of young adults and adolescents who are single, who are brought in by their parents because of some testicular pain, some pathology, and now somewhere along the way they got a sperm analysis, and then now that shows a low sperm count. The kid is rarely interested in trying to fix a sperm count because it's not in his mind at all. But the mom is, and the parents are, and they're very interested in making sure that everything is okay because they can have grandchildren. And in those situations, I actually do offer treatment because, like we mentioned, we don't know what's going to happen to that low sperm count as the kid gets older. We don't know what's going to happen to their testosterone levels as they get older. And so if there is a large varicocele, regardless of whether there is pain or not, if the sperm count is low in an 18-year-old, 20-year-old single male, I do offer treatment because I say, one, let's give it a 2/3 chance to try to see if we can improve those sperm counts. I also believe that the sperm counts will stop declining with age. Because what if that varicocele is actually affecting the sperm counts to go down with time, and now the kid comes back when he's 30 years old and the sperm counts are almost non-existent. And so I think intervening, anytime there is correctable factors to intervene, I think we should intervene. And I don't think there is ever a time where we say a low sperm can just wait with time. I think if there are correctable factors, we should intervene. If there are non-correctable factors, I often recommend something called sperm freezing. So sperm cryopreservation. So patients often think it's just taking and putting sperm in the freezer. No, it's not. It's done in liquid nitrogen. And very good news, it's been done around for the last 50 years. And sperm that is frozen today is good for about 10 to 15 years. And so whatever you freeze today, they can come back and use it 10 years later, and the sperm is still excellent quality. And so if there are correctable factors, I always recommend to go ahead and fix it to try and see if we can improve those numbers. Okay. If there are non-correctable factors, I often recommend sperm freezing to make sure they have something stored for the future.
Okay. Is surgery an option, or usually is it through probiotics and supplements?
It depends on what the underlying condition is. Okay. If the condition is obesity, inflammation, then absolutely medications such as antioxidants and probiotics will certainly help to improve the sperm count. If it is a large varicocele, which are dilated veins around the testis, then surgery is definitely an option. And I do recommend surgery for adolescents and young adults who are single with low sperm counts and a large varicocele.
And why do they get the enlarged varicocele? I mean, what's the logic? Is that just something that happens?
So varicoceles are basically dilated veins around the testis.
Yeah.
And this, just like varicose veins that we get in the legs, the valves inside the veins are deficient. And so the blood from around the testis cannot get pushed back into the body. And so therefore they stay around the testis and they increase the temperature of the testis, and they can affect the sperm production. And so unless you do surgery or embolization to basically tie off these veins, the blood will continue to stay around the testis and affect the sperm production. So it's a good idea if the sperm counts are low, especially at a very young age, to try to see if we can fix that varicocele so it doesn't affect them in the future.
Okay. And then after that, it doesn't reduce.
That's correct. The surgery is about 95% successful.
Okay.
5% chance for it to come back. But if done right, there's about a 2/3 chance that those sperm counts can come back to normal levels.
Okay. And like you said, sperm freezing is also something that people should consider. I think there's a lot of talk about egg freezing these days.
Yes. So sperm freezing has been around a lot longer than egg freezing. Sperm freezing actually started with on the veterinary side with animals, where people wanted to have the good horse sperm to make sure for the racing.
Wow.
And so they made sure that those horses would always be in posterity, so they could do assisted reproduction with the horses that were the fastest on the race. And so the same way with bulls and with the bull racing part. And so sperm freezing has been around for about 75 years now. And so it's actually very reliable and robust. Egg freezing has been around for the last 20 years. But however, now especially with Hollywood and Bollywood, egg freezing has become a very common topic of conversation. But sperm freezing is actually very reliable, and he's been around a lot longer. And it's about 85% successful, even up to 15 years after the sperm is frozen.
Superb. I wish people talk about this more. It's very
Correct.
nice. And what's one piece of advice that you'd give young 20 and 30-year-old men to protect their fertility in the future, for the future?
So I think if you're doing everything in your 20s and 30s to protect your heart and your overall health, I think you're doing everything right to protecting your sperm as well. Okay. I don't think there is anything fancy that is required specifically for the sperm, other than, of course, we talked about avoiding saunas, avoiding laptops on your thighs for long hours, avoiding putting your cell phone in between your thighs when you're taking car rides. I think those are specific nuances to sperm health. But overall, if you're leading a healthy lifestyle, if you're sleeping well, exercising, eating well, less fast foods, less microplastics exposure, decreasing amounts of stress, both from work as well as outside of work, I think you're doing the best thing you can possible for your sperm health as well.
Okay. And suppose everything seems fine to the regular male. How important is it still that they do regular testing or consult with a urologist? Is that something they should still do, like say once in 6 months, once a year?
So I think I think we should think about, I think the question you're asking me is, should we be screening for male fertility?
Yes.
Meaning, should every male who turns 18 years old at some point in their life before they get married, should they get a sperm analysis? I think we are there. About 10 years ago, I don't think we were there. It was completely unnecessary. But especially now with rising prevalence of infertility, rising prevalence of male infertility in particular, I think we should probably get at least one sperm analysis in a guy that's wanting to have kids and trying to start a family in the future. If the sperm count is normal, I don't think routine screening after that is important. If the sperm count is abnormal or on the low end of normal, I think trying to get it at least once every year or once every other year, and if it falls obviously below the normal limits, to consult with a reproductive urologist, I think would be very important.
Okay. So if it is normal, not even once a year?
I don't think so, okay. Yes.
Until you're probably considering...
That's correct,
fertility.
To start a family.
Okay, got it. How do you select which patients require probiotics in male fertility treatment options? So
within a sperm analysis report, there is something called leukocytospermia, or white blood cells. The normal number for the white blood cells is less than 1 million. So anytime patients have leukocytospermia without evidence of any infection, where they have inflammation alone, I think they will respond very well to probiotics. Number two, when they have normal sperm numbers, we talked about sperm number and sperm quality. When they have normal sperm numbers, but their quality alone is affected, they have low sperm motility, or their sperm DNA is affected, I think those patients would also respond very well to probiotics. Okay. So I think if you have a history of obesity, high BMI, poor food intake, ultra-processed food, and you have these signs of poor sperm quality and elevated white blood cells with no real underlying infection, I think those patients would best respond to probiotics.
Any specific probiotics that you recommend, and what's been working for you right now?
So I use a product called Androbiome in my practice. This has been researched with studies done in India, presented at conferences in the United States, where there is a specific types of bacteria and specific amounts of bacteria that are present in the androbiome, which have been proven to improve sperm quality and sperm health. And so I use 2 tablets. It's once in the morning and once at night for about 30 days initially. And then as long as there are no side effects, I continue that for about 90 days. And then I repeat the sperm analysis. Yep. If I see the improvement, I continue it for another 3 months. If I don't see any improvements at the 3-month mark, I usually stop it and think about other strategies.
And is it usually taken as is, or are there other supplements that are kind of?
So it depends. If they have other parameters where I think the antioxidants will help in addition to the probiotics, I usually give it to them. Mm-hmm. But if it's only isolated elevations in white blood cells and where there is inflammation in the seminal plasma, then I usually just use the probiotics alone for 3 months to try to see which one is helping. Because if I give both, if the patients are in a rush and they are like, we need to get pregnant tomorrow, then I usually, just give both in combination. But if patients want to have time and they're trying over the next 6 months to 1 year, then I usually start off with the probiotics, see if that makes a difference before I add other supplements.
Okay. So as one of my last questions, do you have any, say, surprising facts or eye-opening data that could that men need to be aware of, which will help them take their reproductive health more seriously?
Got it. So people need to realize that infertility is actually a very common problem. When they struggle to have children, they think they are alone. All their friends around them have had kids. They're going to birthday parties with other couples their age or maybe even younger than them. And they feel in isolation. They think this is such a rare issue. It's actually not. 1 in 6 couples actually struggle to have kids these days. 15% of the kids born in Scandinavian countries are with IVF. That's 15%. So out of 100 kids, 15 kids are already born through IVF. So they obviously admitted they had a problem with fertility. They've sought a specialist, and they now had a child through assisted reproduction. So I think it is a common problem. It's becoming an even more common problem. And I think the earlier you get tested, the earlier you take action to try and see if you can make lifestyle changes and modifications to your own stress and work, life balance, and so on, and try to improve your overall health and sperm counts, I think the easier this is going to be. The more in denial patients are, especially men, who often think everything is okay with them. I think the sooner they get into the equation, sooner they are able to get tested, sooner they see a doctor and take action, I think the better the chances are going to be.
Great.
Yes.
So in this booming world of AI now, how does artificial intelligence, how are you incorporating it in your field of sperm motility, morphology? Have you done any procedures around it or anything that you can how has it enhanced your treatment options these days?
Absolutely. I think AI has probably, I shouldn't say invaded, but has become pervasive in just about every field.
Every field, yeah.
Marketing, podcasting.
In fact, I'm scared we'll run out of jobs soon.
Yeah, no, I mean, it has almost changed, and we're just scratching the surface with AI. We still don't know so much. Yeah. We expect a lot of harm to happen, but for now, I think we are enjoying its benefits. Okay. Within this field of male fertility, we've now used AI successfully to actually identify sperm in a male, where when we did surgery to retrieve sperm, we were able to search in the lab with obviously embryologists and human eye, and we were not able to find enough sperm for an assisted reproduction cycle. And so we used an AI software program from Australia called Neogenics, is a company The software is called Sperm Search AI. And we were able to use that software to identify the sperm, which was able to be used successfully in the IVF cycle. And the couple is 16 weeks pregnant now. So we're very happy that we are able to now incorporate AI into our surgical specialty within urology, where we not only relying on human embryologists to identify the sperm, but also an AI software to help identify sperm. But I think within the field of reproduction and IVF as a whole, AI is going to enter almost every aspect of the IVF process. It's going to enter the aspect of, let's say there are about 10 eggs and we have about 20 sperm. Now we leave it up to the embryologist sitting in front of the microscope to decide which 20 sperm go on to become eggs. Why should we leave it up to human error or human judgment when we can identify a software that has multiple iterations of IVF cycles that have been fed into it and can identify the best sperm that will go on to become a good embryo and a good pregnancy? And so I think we are now going to use AI to identify which sperm to use to identify into the egg. Let's say we finish the IVF cycle and we now have 3 embryos. Now we're leaving it up to the human embryologist to decide which embryo should get transferred. Why? We can use AI based on multiple IVF cycle successes in the past and failures in the past, because AI learns both from successes and from failures, to say which embryo should get transferred first to see if you can improve their chances of pregnancy. So I think in all of reproduction, in the whole field, I think AI is going to get incorporated whether we like it or not. And I think we should use it. It should never be as a human versus AI. I think AI should assist humans in making the right decision. Humans should assist AI in making the right decision, because the more data we feed into the AI software, the AI is going to give back good results. So I think we should embrace AI. We should use it. We should not fight it. And we should try to see what we can do to use it to enhance patient outcomes.
Absolutely. And does this go for the egg health as well?
Absolutely.
The software is...
Absolutely. I think we're not very far from making it routine practice in almost every IVF laboratory, where we now have AI software helping us decide which sperm should get injected, which embryo should get transferred. If the sperm are not present, is it present in the sample? Anywhere where we can now use it for the IVF cycle. I think we are there. I think we should embrace it, use it, and try and see how we can incorporate it into the practice, into the day-to-day practice, and not try to see, it's going to take away our jobs. We should try to see if we can, we are better than AI. I think we shouldn't keep fighting that battle.
Absolutely. I think we're all a little nervous about it taking over, but I think coexisting with AI is the best.
Absolutely.
Dr. Ranjith, thank you so much for being here today and for sharing so much with us. These are such important conversations, and I think a lot of people, both men and women, are going to walk away from this episode feeling more informed and more empowered to take any action if they need to. Whether someone is thinking about starting a family now, or if you're just trying to take care of your health for the future, understanding male fertility and sexual health is such a big piece of the puzzle. Thanks again for listening in. Take care, and we hope to have you back again soon. If you found today's episode helpful, be sure to follow the show, leave us a quick review, and share it with anyone who might want to hear this. Catch you next time.